Greetings, Epicentre family. I'm Cheryl Jang, and as an emergency physician, I've been asked to give a bit of an update about our corona COVID status. Since our shutdown in March 19th, we've been going through a lot of changes, including pandemics, quarantines, unemployment, school closures, civil unrest. We now face progressive reopenings with their surges. So let's look at some of the local and global happenings, some progress, and maybe touch upon some biblical responses that we might have to what's been going on. First of all, I want to say that the U.S. is the global epicenter of both total disease incidence and death from COVID. So I wanted to put up some graphs and show you kind of pictorially what's going on. The first chart shows us the total U.S. number of deaths and anticipated deaths. It kind of ends in June, and then there's a hashtag line after that, and it predicts that our death rate is going to continue to mount all the way up through October. Our best time may actually be now, because we think that in the summer months with the heat, this disease is thought not to survive as well. In our second graph, we're looking at a pink shaded area and a funny little line. Now, this is the incidence of deaths that we've had in the US, and you see that it's actually plummeted and it's leveled out. But now, as we are reopening, things are like a little unsure, and we just can't figure out what's going to happen in the future. So there's a huge predictive statistical error rate right now, and that's why that pink shading is just a huge margin of what it might look like coming all the way up to October. Right now, it's just hard to tell where all of this is going to go. But globally, we've been seeing some interesting things. So on the third graph, what we're going to do is flip down and look at Brazil, which is below our equator, and they're actually having the flip season now. So they're actually in their winter season as we are entering into our summer season. Still, their COVID rate has overtaken and surpassed our death rate, which is truly, truly frightening for Brazil. So we are seeing what a winter season is going to kind of maybe perhaps look like for us by taking a look at what Brazil is doing right now. And right now it's beginning to surge, and it's frightening. If you look at the dotted line, it's not going to be letting up between now and October. Their winter season does end in September, so we'll see just what happens. Now, on a total global scale, this next graph just shows this dotted yellow line just scooping up and continuing upwards, and that's the total number of cases around the world of COVID death. So it's not going down, folks, ladies and gentlemen. And this was sort of the prediction that even though we had done well in the beginning, we would have secondary surges, and that countries would have to open and then close and then open and close to go ahead and satisfy the socialization needs that the communities and the people would need to have in order to live. So we're doing that right now. But meanwhile, the graph continues up. The take-home message is that COVID is just far from gone from us. What does it look like more locally? Well, in California, we have now instituted a statewide mask policy. So that means everybody's got to wear a mask out in public. Now, this was in part a response to what happened in the last 11 days. In 11 days only, our incidence of how many people are getting new COVID diagnoses increased from 5.8% to 8.8%, just in the last 11 days only. So it's not slowing down anywhere in California, to the point where we now believe that 1 in 4 Californians are actually infectious, not just have COVID or had COVID or maybe COVID, but are actually infectious, and you can get COVID from them, 1 out of 400. And if you look at statistical probability, and there's numbers that they crunch, this can be really anywhere from 200 to 750. So in its worst, 1 out of every 200 people that you bump into at the grocery store or over at Trader Joe's or at Costco could have COVID and potentially give it to you. Continue to keep your 6 feet mask distancing from other people. And, if you're singing, if you're coughing, if you're exercising and exhaling, vigorously, then you've got to widen that, because you're just projecting your particle sizes. So just make sure that you have a good distance between other people and that you are always masked. Please mask. And also, COVID people not only shed COVID through their breath and through their respiratory droplets, we actually found out that they shed it through their stool, through their poop, through number 2. None of this is making sense to you. Sorry to be so indelicate. So you really need to have good bathroom habits. Sorry, this is indelicate again, but make sure that you wash your hands all the time in the bathroom. And if you have to use a public bathroom, then, use a paper towel, push open the stall doors with the paper towel, use it to hang your purse on top of, open the faucet handles with the paper towel and the soap dispenser. Try not to touch anything because COVID actually is alive and well in stool and feces. We've also had reopenings of our restaurants, and aren't you just tired of like the same 20 Instapot recipes that you've been going through for the last 3.5 months? But it's so exciting to maybe go out and get something real and sit down and have a meal outside. Well, LA County actually surveyed their restaurants that they have given entire protocols on how to stay safe and how to be able to service their customers in a safe and responsible fashion. And 50% of them 2 weeks ago absolutely failed. So 50% of restaurants who have already opened for sit-down dining have failed to meet the LA County protocol policies to have a safe environment for you. So you might want to think about that as you go out and take your next meal. And lastly, know that asymptomatic people or those with very, very mild disease can still transmit the disease. I know there was a little confusion about the WHO announcement, but they actually kind of retracted it June 9th. So yes, indeed, mild and asymptomatic people can actually transmit the disease. Actually, the first major inter-country kind of transmission was a man who came out of Wuhan, went to Vietnam, stayed in his father's house, and in 3 days that father came down with it and the man didn't have anything. So yes, we know that asymptomatic people can transmit this disease from the very beginning and from the very get-go. All right, so back to California. How are we doing? If the next graph shows up, you can see that what we have at the very end of the tail end of the graph is a beginning rise in the yellow and just a big beginning upward turn of the orange. And that's what's showing hospitalizations in orange and the incidence in yellow of people who have COVID within California. So yes, it is upticking. Just recently, we had been leveling off, even going down, and the upticking is occurring now as we reopen our state. And who else is this really affecting? Everyone thinks that it's just the old people, those who are 65 and older, who are really getting COVID. But in fact, the biggest number of people who are getting this in terms of a quartile, in terms of a group, are actually those between the ages of 18 and 49. So in LA County, 95,000 plus cases. For the 65 and older, only 27,000 cases, okay? So that's a big difference there. And that group in between 50 and 64, 38,000. So again, the biggest number of people who are actually contracting disease but not necessarily dying from it are ages 18 to 49. Now, the kiddies are a little interesting. Those who are 0 to 17, there's actually almost 13,000 of them. And again, they have had a very mild disease. It is not severe for them. And this is a whole biblical mandate for us. Our young people, though they may get the disease, are somehow protected. Okay, God is doing this, thank goodness. And so there's a whole mandate for what will happen to this whole next generation, we think, through COVID. But still, the older generation does have the most risk in terms of severe and, deathly outcomes. So those who have comorbidities and age 65 and over, we still want to be ultimately very responsible to them and try and shield them from catching any disease. Now, how are we doing in terms of testing? There's antigen testing, the PCR testing, there's antibody testing. Well, the antigen testing, the testing that tells you whether or not you have COVID, that's called a PCR testing. We're getting pretty good at that. And our hospital, in fact, just got the 15-minute Abbott test. So this will be exciting to see whether this actually works or not, whether we can really tell whether you have it in 15 minutes instead. We had the 2-hour test and then we had the 2-day test. Now we're going to the 15-minute test. So, okay. So our testings are pretty good. They're getting more and more reliable. However, we are finding a subset of people, though, who will not be positive, who will not actually have respiratory symptoms. They may have more GI. They may have more other manifestations. And because we are swabbing the nose and they don't have respiratory symptoms, they actually turn out to be negative. So it kind of depends who you are. But for the most part, our PCR testing is doing pretty good. Now, in terms of our antibody testing, the serum testing to figure out whether you've had it or not, that's not quite as good yet. So It's okay, it's not quite as good, but we are learning things from it. And so some of the things that I want to tell you is that if you've been antibody positive, saying that you've actually had COVID, does that mean you have lifelong immunity? And it's like, okay, I can go anywhere and touch anybody at any time because I'm immune now because I already had it and I made antibodies? And the answer is no. So we're actually finding out that those who had low-level cases of COVID within 6 to 8 weeks or so, they'll actually be antibody negative. So you can actually revert back to like not having anything, and so you are at risk again. Those who've had really strong cases and severe cases of COVID seem to mount the highest amount of immunological responses. They have the highest numbers of antibodies and they seem to last longer. So, if you got killed, if you got really severe case of COVID, you actually are fairly well protected for some period of time. What is that period of time? Is it lifelong immunity? And the answer is there's no evidence yet for any lifelong immunity. Maybe just a season. So maybe just for the season. By next year, you may be, vulnerable again, and it may be something like the flu shot where you get yearly flu shots and yearly COVID shots. I mean, it may happen like that. So we're not quite sure. Data's not in. It's too new. Hang in there. Time will let us know. I did want to say something about MISC. So for parents who have kids and they've heard this thing called multi-system inflammatory syndrome in children with coronavirus. Try saying that 5 times. Okay, MISC for short. That this is kind of looking like maybe a Kawasaki's disease where kids had rash and fever and they were COVID positive. What we're finding out is that this is actually very much an inflammatory response. That looks like the end of those adults who had really bad COVID disease and were really overcome by an inflammatory system response. This is what the kids can get. And this can be really, really significant. Now, in Italy and London, their cohorts, they got seriously infected. I don't actually know their mortality rates, but I know that in New York and Michigan, in the first 3 weeks of May, New York had 34 cases that went to their intensive care units. None of those kids died. Michigan had slightly more. They did well, thank goodness, for our intensivists and our medical teams. Yay, team. And in California, we've had less than 10, okay? So the cohorts are different between cities, between countries, but so far, again, the kids are doing overall amazingly well. And we've got stuff for them now. So it's like we do have some medications and we do have some protocols out there. So yay, hopefully this will be good. So that actually is kind of a segue into the treatments. COVID is actually kind of a 3-tiered response, if you will. We have 3 levels of treatment that we can offer to our patients now. So in the beginning, infection with the virus, we want to take a look at giving them medications that will prevent viral replication, viral implanting. We have convalescent plasma for more antibodies to them. In their middle phases, as they're having a response, their first inflammatory response, we have stuff for that, anticoagulation. At the far end, when this whole inflammatory system seems to overtake people, you don't really die from the virus, you die from your own body making a huge inflammatory response to the virus and it just overcomes you. We actually have drugs for that too. So we have things all the way through now in the 3 kind of levels that we're seeing in a COVID response. So yes, we're doing better with our treatment. Now, the big question on everybody's mind is, well, okay, forget the treatment. Can I just not get the disease at all? Can you just give me a vaccine? I'll even take a shot so that I don't get the disease. And the answer is, well, not yet. We have over 140 companies putting out vaccine trials and research right now, over 140 worldwide. That's a huge amount of effort going into this one vaccine. But realize it takes a long time to make a vaccine. It's between 5 and 10 years. Okay, not months, years. The most successful vaccine that we've had in the shortest period of time has been the mumps vaccine, and that took 4 years. So we have to suffer through COVID for 4 years before we see a vaccine. Not sure. Maybe. We'll see. What we're doing right now is we're doing our trials. So vaccine production actually takes 3 major stages to actually produce a vaccine. The first one is a safety trial, and many of our vaccines have made it through the safety trials where we give it to a small number of people, and we want to make sure that we don't kill them. We've actually rushed vaccines for dengue and also for RSV, and we've actually killed people with our vaccines. So we're trying not to do that. So far we have some companies that have been successful through their phase 1 safety trials. Yay, so that's good. We're into phase 2 with some of them. And phase 2 are the expanded trials where we give the vaccine to adults and kids. And we want to make sure that 1, it's safe, but 2, they also have an immunologic response where they're actually building antibodies and it's actually doing what it's supposed to do. So that's phase 2. After we finish phase 2, then we go into phase 3, where we give it to thousands of people, but we also give a placebo to thousands of people. And then we compare whether these thousands of people, those who got the vaccine and those who got the placebo, will actually contract the disease or not. So this takes another season of infection to go through and to compare whether, the vaccine is actually doing anything. And then we have to put all the data together and mush them all together and see if it's safe, and then crank out a drug that we think is okay. So those are the 3 phases that we have to go through in making a vaccine. So it takes time. The U.S. government has just, been saying that it's going to get one by the end of the year or, by spring 2021. And what they've actually done is, a nod to us old people, is put out Operation Warp Speed. Yay, I love Star Trek. Yay. But Warp Speed, at a cost of $2.2 billion to 5 companies right now, 5 companies to go ahead and make a vaccine. These 5 companies have 5 different vaccines under 5 different platforms that they're making it. And so we'll see if anyone is really, really quite successful. Those 5 companies, Moderna, J&J, Merck, Pfizer, and AstraZeneca, in case you wanted to go and do your stocks. Also, there's Emergent Biosolutions, which is the company that would actually mass produce the vaccine. So you might want to look for those names in case you're investing. But these are the companies that have been awarded a huge amount of money to try and get a vaccine to put out by 2021 spring. Is it going to be successful? Can we just say, aha, and COVID will end by next spring? We don't know. So they're even trying to combine phase 2 and phase 3 trials by the end of this fall. They say things are going to start for one company in July. We will see. I don't know. So hang in there. So COVID's not going away. What is going to be our response? How do we live through this? I was doing my FaceTime yesterday, and the Lord took me to 2 Kings chapter 5. And this is the story of Elisha and Naaman. And Naaman was a mighty warrior commander under the king of Syria. So he's a Gentile commander, and he had leprosy. Of course, behind every great man is a great woman, and his wife had this female servant, a young girl who was actually an Israelite girl who was abducted from probably one of their raids that they had in Samaria at the time. And they took her out of the Israelite town, and they kept her and brought her all the way to Syria. It sounds really tragic, but hang in there. There's more to the story. This little Israelite girl tells her mistress, "Oh my, if only my lord," Naaman, the commander, would have a confrontation and seek out the prophet from Samaria. The prophet from Samaria would heal him. Oh my gosh, what a little exhortation from this little girl there. So cute. So Naaman gets all excited that, oh wow, there's just someone who can heal me. He asks permission, gets it from King of Syria, plunks himself down, goes down into Samaria, and puts himself in front of Elisha's door. So he's in front of the prophet, knocks on the door and goes, aha, I'm here. He's mounted on his horses. He's got his army all around him. Regality. He's got presents for Elisha. You're going to heal me. This is going to be a great day. We're going to have a good time, right, guy? And it's all going to be done because I have shown up at your door and I deserve this. So this is Naaman's expectation. Elisha is like, okay, I knew you were coming, but he doesn't even come out of the door. He sends his servant, a messenger, to go and say, hi, Naaman, okay, you're going to be healed, but you need to do this. So turn around and go over to the River Jordan, plunk yourself in and out of the river 7 times, and you will be, 1, restored, so your leprosy will go away, and 2, you will be cleansed. There's some sort of ritualistic, spiritual additive there. Not only just your leprosy is going away, but you are going to be cleansed. And And instead of being really excited, like, whoa, this is true, I'm going to be healed, he's like, wait. No one comes out and talks to me. There's no face-to-face confrontation. I've come all this way. Hey, I'm the commander of the Syrian army. You owe me a little respect. Come out here. Tell me yourself. Take me to wherever I need to go. You just don't give me instructions. He is like totally offended because he had this expectation of how he was going to be healed. Now, all his friends with him are saying, his servants are like, Naaman, just do it. Just do what they tell you to do, okay? And he finally acquiesces. He gets over his little entitlement phase, goes over, does the thing in the Jordan River, and waha, he is totally healed. Healed and cleansed. So much so then that now God becomes his God. He forsakes all his other gods. He says he's not going to worship anybody else. He goes back to Elisha and tries to offer him presents and say, wow, you are like the best. Elisha refuses and says, no, that's not what this was all about. Sends him on his way. And you think the story is ending. Happy ending. Except the little servant of Elisha, Gehazi, a little fool that he is, greedy fool, disobedient and rebellious, chases after Naaman and goes, excuse me, sir, gives him a lie and extorts the money and the presents that Naaman was originally going to give to Elisha. And he takes it for himself. So he takes money and clothing for himself, hides it, does not tell Elisha. Oh my gosh, does not tell Elisha, and goes home thinking, okay, win-win, I got my stuff, they're on their way, all is well. Until Elisha confronts Gehazi. Now, you just don't lie to a prophet. How dumb can you be? Elisha says, so where have you been, Gehazi? And he's like, nowhere. And Elisha totally knows and says, Gehazi, really, come now, sir. Was this the time to go ahead and expect money and clothing and garments and olive orchards and vineyards and sheep and oxen and male and female servants? Was this the time to be gaining these things? And Elisha's clearly saying that there are seasons. And was this the season to gather and garner all of this? Was this season to feel entitled that you should be allowed all this? And not just the clothing and the money that was originally offered to Elisha by Naaman, but Elisha goes further. He's talking about orchards and vineyards and sheep and oxen and all sorts of things bigger than even what Naaman was offering. He's talking about dreaming. He's talking about the promised land. He's talking about all these great, lofty, idyllic types of things that one hopes for in their heart in a really comfortable state. And he's asking, is this the time to be thinking about that season? So most of us in this COVID season are so tired of our menus and being stuck at home and having the same daily routine over and over again. We're really longing for something else. And we're longing frankly, to go back to how it was before COVID, because we think that it was so great. And we want to actually maybe perhaps go back to Egypt, where things weren't actually that great. We were so distracted with all our things, our entertainment, these activities, these meetings that weren't necessary, that maybe we didn't get down to the core of what God really has for us in this season. So as God has cleared time for us in COVID and really taking out the distractions by allowing us to have this quarantine time, perhaps it's time for us to really think and center down on what this season means. So think, is this the time for clothes and money and sheep and oxen and orchards and vineyards? Or is this time to really come to me and worship in beautiful time and reading our word together and getting your family together and having that structure? So families must be having just an amazing time together or a really horrific time together because they're cooped up so much together without these other distractions and outlets to afford them variability in their routine. But if it's time for us to really come back to the Lord together as a family, I know that my family, we've gotten so close during this time and it's just been wonderful. So grateful to the Lord for allowing us to get these distractions out of the way. For those of you who are single, who don't have this family structure, yes, the doctor is going to say, gather with someone to make a cohort, make a family, whether it is your small group, your BFF, your neighbor, whoever it might be. Have someone, whether by Zoom or in person, that you will be growing in the Lord together closely with. This really planting down your seeds and your foundation and learning all that you need to about this time and the season. Get your stuff worked out and be ready for the next level when the next level comes. When the next level does come, so think about the little girl, how tragic the Israeli little girl who was plucked up out of her family and put into a Syrian family, and now she's without, her whole little village and stuff, and she has acculturated into a whole new thing, and yet she's the one who makes Naaman come down to Israel, see Elisha, get well, and he's a commander of the army. He goes back now with faith. He goes back and saying, this is the only God who's going to be my God, my household's God. The wife is just thrilled because it was her little, servant, and she told him about it. And now they are going to be seeking after the Lord. And the only one who can really point them to the one true God is this girl, this little girl. This little girl who was plucked out of anonymity, and she came and she saved the day. I want to meet her later in heaven. I want to know her story and what happened to Naaman and the wife and the family as a result of all this healing and this miracles, and this man just emphatically saying, this is going to be my God. I'm going to bow to no other. So this story can have very, very positive endings if you just know the season and the time that you're in. Is this the time for this? Or is this the time to really center down with the Lord? So I hope it's going to be the latter for you, as it has been for my family. And you don't really need to worry about this COVID season so much. I'm not really putting, my faith as a frontline worker in my PPE, in my hospital, in a vaccine, in ventilators. My faith is going to be just in the Lord. He's going to take me, he's going to keep me, and he's going to keep my family safe every time I come home after my, encounters with my COVID patients. It's all going to be up to the Lord what he will do. I will do my best. I will be responsible. I will be loving and vigilant toward others, not trying to spread disease, not trying to be, trifling about masking and our quarantine situation. I will be responsible, but ultimately it's going to be the Lord who's going to preserve me and my family, and I'm not going to have fear. My time is up when my time is up, and before that, my time is not up. No one's going to take it away from me because I trust in the Lord and you trust in the Lord. Amen. So I just want to leave you with that, and maybe with one little last picture, if you can get it up there, that says, if you don't like wearing a mask, you won't like the ventilator either. So please be safe out there. Love on those who are around you. Know the season and the time that you're in. Be grateful and thank the Lord for what he has given to us during this season. Amen. Blessings, Epicentre fam. Until next time. Bye-bye.